Would my loved one qualify for hospice care? This question is always a confusing question for everyone, patient, family, and treating physician or even a primary care physician. During a chronic disease, patient goes through many phases. There are days when they are doing much better, and there are days where it seems like no matter how much you try, the treatment and the system seems to be failing. It seems like you are taking one step forward and two steps backwards. Hi, I am Nurse Rupal. We will have two parts to this topic, as one is just not enough to cover. In this episode, we will see how dementia, a brain disease, affects patient and family. For those who are not familiar with this disease, dementia is something that robs the patient of his or her entire life. It takes away the biggest treasure of patient's life, memories, and self-identity. And to see a loved one being robbed from this treasure and not able to do anything to stop seems to be the most devastating time of one's life. One quick note, before we start, hospice eligibility is based on each person's medical condition and a clinician's assessment. Medicare, Medicaid, and private insurance coverage details can also differ. So check with your loved one's clinician and a local hospice provider about their specific situation. Now, to give you a little background, the most common types of dementia are Alzheimer dementia, vascular dementia, Lewy body dementia, and frontotemporal dementia. Out of these four, Alzheimer dementia is something that prevails the most in community and is the biggest robber of all. Why is that? Alzheimer dementia can start as early as in mid to upper 60s and can last for more than 20 years till the patient dies. Alzheimer dementia is an abnormal protein buildup in brain that damages the neurons, causing the memory loss, cognitive decline, and behavioral changes that worsens over time. Alzheimer dementia can start with some forgetfulness in the beginning, then with short-term memory loss, then forgetting self-care to life events to distant and close family, and then not having any idea of anything that goes with themselves or around them. It is the most painful thing for loved ones to see this, to watch this. As disease progresses, patient could not recognize their spouse, their children, their grandchildren, friends, or any other family members. Patient is robbed. Patient is clearly unable to request for any help here when he or she does not know anything that is going around. Family is confused, lost, and emotionally robbed to see their loved one robbed out of themselves. When could a family ask for hospice care during this journey? Initially, when patient is just forgetful here and there, it seems like a normal stage of aging. There is possibly no diagnosis as patient does not seek any help. Patient might not even mention this to their primary care physician during their annual checkup. In fact, there are some patients who does not have a primary care physician or does not go to primary care physician that regularly or even annually. Hence, life continues as usual and the robber continues to rob the brain. Then comes the next level progression, short-term memory loss. Forgetfulness and short-term memory loss kind of goes hand in hand. During this phase, patient is already forgetful of where they left their car keys, house keys. Why did they open the refrigerator? Why did they go from one room to another? And much more little things of daily living. With short-term memory loss, patients forget phone call or an in-person conversations with family, friends, or coworker. They even forget that they brought grocery day before, but bought it again due to not remembering. Lost the way to home from routine grocery store, and much more. This starts to be concerning to patient and family. Patient is likely to see a doctor now and finding out what is wrong. They are probably learning all about what Alzheimer dementia is and how to deal with it for the very first time. What are the next steps? Are there medications to slow the progression? What if the patient is lost while driving and ends up in a strange place? Or an accident? Is he or she eating well? Are they safe in the kitchen around stove or use of a knife? Patient is now asked to not work, not drive or cook, receive help from the family, or seek living in an assisted living. None of these options are appealing to patient, and he or she is irritated. Stress increases within patient and family. Is hospice care a good option now? Would patient qualify? Most likely not, because according to the CMS guidelines, patient is still mostly independent of eating, walking, bathing, dressing, and toileting. These are called the activities of daily life, which is called ADL. In here, some requires some assist, but mostly they are able to carry out all of them on their own. Patient is still able to recognize their closest family members. Patient's prognosis at this point does not seem to be 6 months or less. This is where palliative care could be an option, maybe even along with home health, but not hospice. One important clarification. This is a general education, not a universal checklist. Hospice eligibility is based on the whole clinical picture and a physician certification that if the illness follows its usual course, life expectancy is 6 months or less. A hospice team can review the individual situation. If you are noticing these changes in a parent or spouse, the first step is getting them in front of a doctor who can properly evaluate memory and thinking. There are medications that can slow the progression of dementia, and whether it is covered by your insurance or if you qualify or not, all these are to be discussed with your doctor. Start the hard conversations early about driving, cooking, safety at home, and who would make medical decisions if your loved one could no longer speak for themselves before a crisis forces the decision. And remember, sudden confusion or a rapid change from the person's usual memory or behavior should be medically evaluated promptly. Do not assume it is simply dementia getting worse. Let's check our next episode to see what can qualify a patient for hospice care. If this episode helped you, please like, share, and subscribe to Nurse Rupal. And visit nurserupal.com for free caregiver resources and guidance. See you again in part 2.